Okay. And we're going to start the slideshow here. Can everyone see the slideshow? Yeah. Okay. Real quickly, this is a collaborative effort of 4 Northern New Hampshire hospitals, 3 from the North Country Health System, Androscoggin, Upper Connecticut Valley, Weeks, as well as Littleton Regional Hospital, along with the Harvard Pilgrim Healthcare Foundation, who offered upfront a $500,000 matching grant. We also have contributions from Fidelity Health, Fidelity, and from the Endowment on Health to help us out with this. And I'll go a little bit on the numbers and everything as we kind of move along. But this came of an idea of about a year ago. I approached, I was in a meeting with all the carriers, and I said I have this dream to have high-end mobile vans that we could have a fleet across the state to help with outreach on primary care, preventive services, and immunizations. And as a result, one of his last acts, Dr. Bill Brewster, essentially pushed through this $500,000 grant through their foundation, literally the last thing he did before he left, to help spur this. It was going to originally go or try to go to a 501c3 in Coos County, but for a number of reasons that couldn't happen. And so the Medical Society was approached, and we were asked if we could run this through our foundation, the Bowler Bartlett Foundation. And we agreed to that. So we're acting as essentially the fiscal agent in this endeavor. And we're just beginning our governance meetings and moving forward with some kind of key decisions. And I'll articulate those as we go through this. First, as many of you know, the rural areas have limited access to preventive screenings, wellness educations, and this is an effort, collaborative local effort to help stimulate that. And we're really targeting to launch, hopefully by the end of the second quarter in 2022, that this will be with the 4 hospitals, and we may have some other participants join on by then, but for Coos and Upper Grafton County. The background really here is to make sure that we can promote these preventive screenings, health education, substance use, other preventive screenings, and immunizations as we move forward. This is a handicapped accessible van that you'll see in a little bit. So our service area that we're looking at, as you can kind of see, it's pretty much north of about Littleton and Twin Mountain up through the northern reaches of Coos County in the state is our target population. The funding of the project has come from a number of sources, as I mentioned before, the 4 hospitals, Harvard Pilgrim Foundation, Fidelity Investments, and New Hampshire Charitable Foundation, not the endowment. So with that, we are able to raise through those $760,000. Now we have pending a USDA rural emergency grant and actually it may go a little bit higher than that amount to $300,000. So right now with that grant, and it looks very favorable, but we're kind of going through the mechanisms on that right now, that will have raised a little bit over $1 million. We also have very detailed budgets for startup costs right now, which is about $460,000. And we estimate that our annual operating expenses will be a little bit under $200,000 per year as we move forward. This will all, because this is a kind of a novel event, we're basing this on what other mobile vans of similar size and arrangements have kind of cost. The last thing that we'll put into the budget is, and we're working through this, there'll be discussion for our governance board, will be a per diem fee, kind of a rental fee that we'll charge to help sustain some of the funding. We may go to other funding sources, Again, the Medical Society will engage as long as they need us to be fiscal agents, but we hope we can turn this over to a 501c3 organization, and we're in some preliminary discussions to do that as we're speaking. So again, the 3-year timeline that we have thus far is one, to begin our fundraising efforts to order the van, which has occurred. And then we have a governance committee pulled together for this. In 2022, we're going to develop in the first quarter some metrics reporting and how to do that on a daily basis, and to make that fairly straightforward online kind of reporting that we can bring back information and how we're performing overall. Our soft launch will probably occur, my guess is either towards the end, sometime during the summer months, I think is the easiest way to say. And then in 2023, we hope to essentially deepen our relations with this outreach effort and adapt our plan as we need to based on the evaluation, based on the feedback that we're getting from the local communities. Our first year projected goals, if we launch in that time period, is 300 flu vaccinations, connecting 50 individuals with a local doctor, triage 40 individuals who have behavioral or substance use disorders, and help 20 individuals who are struggling with food insecurity, as well as to help increase health literacy and awareness events. And we'll participate in 2 community events, as well as offering wellness education sessions various localities. And this doesn't have to be it can be anywhere. So we think there will be some partnerships with schools, and with immunizations and other kind of outreach services as we move along. So the van looks something like this. And as you kind of see, there's an awning. It's a handicapped disabled vehicle. And there are 2 refrigerators, one for medical use, one for staff use. There is essentially a triage room in the back for a full exam room that can be used in the back of the van, and then an intake van in the front half of the van. This will be a diesel vehicle because we get it's going to be a little bit bigger engine. And a little cheaper gas mileage. So that's why we chose Mercedes at this time, based on those factors, and needing 4-wheel drive for the winter months up there, or a couple of the heavy considerations, and choosing to go in with Mercedes versus some other mobile van arrangements at this time. So again, our planned launch date is in sometime this summer, hopefully. With everything, by locking in right now with our purchase agreement, we'll be able to have a delivery that is not going to face some of the supply chain problems that we're kind of seeing across the country, across all sectors. So I'm happy to answer any questions that you might have about this, and as we move forward. The last thing I'll add is this is a pilot effort. We do have another carrier who's interested in doing something similar. So if in one of your areas you think that this kind of model might work, where we could bring together several collaborators, then please give me a call. And because ultimately, again, the vision is to do this in multiple locations across the state. So give me a call offline. My mobile number I'll give to you if you'd like to talk is area code 202-520-5809. Again, that's 202-520-5809. Thanks, Kristen.
Thank you, Jim. So if anybody has any questions for Jim, just go ahead and come off mute, or you can drop them in the chat if you're more comfortable doing that. Or I assume, as Jim said, it's okay to reach out to him directly if you don't have your question prepared right now. But I think this is a really exciting initiatives. So I can't wait to see it moving around the state. So it's great.
Hi there, Jim. I'm Rosemary Ford. I have a question. I work at St. Joseph Hospital in Nashua, and I recently took over seeing our mobile health clinic, so I'm very interested in connecting with you offline. I'm curious, how are you staffing this? Is it per diem positions from the multiple hospitals that you're partnering with? And question number 2 is, how are you staffing them? Is it with nurse practitioners, RNs? I'm just curious to learn a little bit more.
Yeah, that's still under development, but I think the outline of the plan right now is that each hospital on a per diem basis will bring forward whatever staff complement that they have. There's probably one of the operational discussions is whether our operations agent will actually be more of a social worker who will be driving, maintaining, bringing that around. But I think the commitment from the 4 hospitals right now is that they will bring teams together and schedule their own staff for these teams and these outreach efforts. And it will probably vary depending upon what setting we're going into and what we have planned to do that day. But it will likely be some kind of either an NP or a PA, could be a physician, in some circumstances, if we do that. Probably be, teams, including the driver of 2 or 3 to start with. And then that's what we've looked at other models in other areas of the country, and that's typically what they do. And the commitment from the hospitals is to essentially offer their staff, they pay for it. They will be billing regularly for services that they provide if they can bill them, whether it's to Medicaid or insurance or something else. So that's, you may be familiar with another effort which was happening in Coas County. It was called the Molar Express. And essentially you took dental equipment into schools. And it was very successful for 3 years, but what we were told up front is they really didn't do a good job in the financing. And so they had to, once the original grants came through, then the funding dried up and they had to pull back the program after 3 years, even though they wanted to extend that. So that's what we're really trying to do with this, is make sure that there's adequate funding models up front and that we can sustain this well in advance of what the immediate financial needs of this project are. Thank you for your question. And happy to talk with you offline.
Great.
Jim, there's another question in the chat. I'll just read it. Does your operating budget include staff time, such as coordinators, drivers, and the medical team?
Great question. Thank you. So our budget right now is for that coordinator, the scheduling, and we factored in that this would be a full-time position who would be actually, with the van at all times, probably the driver and the intake individual personnel, and that 1 or 2 staff members from each hospital, depending upon, again, what the case mix or what our outreach effort is going to do, would be staffed by the hospital. So that's separate from our budget, and it's a commitment that the hospitals make.
Great.
Jim.
Any other questions for Jim?
Hi, Kristen. Tori Jennison with the Public Health Association. I have one quick question. If you can speak to the information sharing plan a little bit about, is there an electronic record and how is that being managed? Is that still under the governance idea? We've done a lot of work with the integrated delivery networks to create community care teams where there are mechanisms to share information with non-traditional healthcare providers like the social service folks. So I'd be really excited to see that move forward and help in any way we can.
Well, thank you, Tori, for that. Yeah, that hasn't been determined yet, but we'd welcome that kind of input on how that can be best facilitated among all the stakeholders involved. So thank you. Happy to have further discussions with you on some models that you've seen work in that regard. But no decisions have been made thus far. We've only had, of the governance body, we've only had one organizational meeting, and that was really just to move forward with the purchase of the vehicle and then start to set up some of these ongoing finance. And I believe probably in the first quarter, we'll start talking about information coordination and tracking, recording of information that we will do on a daily basis for the vehicle.
Great. Any other questions? Okay, well then I thank you, Jim, for your time and the information, and I think we're all going to be really excited to watch this project roll out. And it's definitely neat. If this last years have taught us anything, it's that how critical this type of service is going to be. So thank you. Okay.